What are the treatments for COPD? COPD, or Chronic Obstructive Pulmonary Disease, is a chronic lung disease that makes it hard to breathe. Although there's no cure for COPD at this time, it can be managed. At the Temple Lung Center, we're able to develop a tailored treatment just for you. In the last 8 years, we've cared for over 30,000 patients with COPD. Treatments for COPD generally focus on slowing the progression of the disease and relieving symptoms. Treatment is handled in a variety of ways and often includes smoking cessation, medications, pulmonary rehab, and oxygen for those who qualify. A few patients may benefit from surgery or possibly participating in a clinical trial. Naturally, the most important step a person can take to slow the disease is to stop smoking. Smoking cessation has been shown to improve survival even once COPD is diagnosed. We even have a smoking cessation program here to help with that. Medications play an important role in improving the symptoms of COPD. They are what we call short-acting and long-acting medications. Each patient is different, so these medications need to be tailored to each individual by their doctor. We encourage our COPD patients to enroll in a pulmonary rehab program that includes counseling, education, exercise, breathing exercises, and nutritional guidance. Pulmonary rehab can help reduce symptoms and improve quality of life. COPD exacerbations may also require additional treatment, including an increased use of inhalers, steroids, antibiotics, or all three. Oxygen therapy is needed when oxygen levels in the blood are low. At first, patients usually need oxygen just at night and with exercise. Later, oxygen may be required all the time. Patients with a very advanced stage of this disease may be offered the option of COPD surgery, such as lung volume reduction, or even possibly a lung transplant. In lung volume reduction surgery, or LVRS, parts of the lung most damaged by the disease are removed. Usually about 20 to 30% of the lungs are taken out. This volume reduction allows the lungs to work more efficiently. LVRS may lead to an improved quality of life and even improved survival in some patients. Some patients that still have a lot of symptoms, even with all of the available treatments, may want to consider participating in a clinical trial. A clinical trial helps doctors determine if a new treatment is effective for COPD and may also help patients with their symptoms. These trials may focus on new medications or possibly a procedure to help with patients with COPD. Since people with COPD are more likely to get colds and the flu, they should receive a flu shot every year. Most patients should also receive a vaccine to prevent pneumonia. And of course, eating healthy is important to help maintain a healthy weight. It's so important that people with COPD stay active. Exercise helps build muscle strength and endurance and can sometimes reduce shortness of breath. COPD patients can usually make exercise a part of their pulmonary rehabilitation program. To schedule an appointment with the Temple Lung Center physician, call 1-800-TEMPLE-MED.